Good afternoon, everyone. This is Vicki James, a member of the Technical Assistance Team for the HCI. I want to thank you for joining us for this webinar this afternoon. Just a few reminders before we get started. All of your phone lines are muted to reduce the background noise. So please be sure that you click on the audio pin so that your line can be unmuted if you want to participate in discussion later on. You can always, of course, type your questions in the question box, and Sean or Jeff will share those with our presenter today. Please be sure your computer speakers are turned off or muted if you're dialing in using the phone. This also helps prevent some of that background noise. The webinar slides for today were posted on the HCI SharePoint calendar if you want to print them off and take notes. They're located under Resources in the HCI Webinars folder. This webinar, as always, will be recorded and archived on SharePoint with the slides. First, we're going to begin with a slideshow presentation, and then there'll be questions and discussion afterwards. So feel free to type questions in anytime along if you need to on the right side of the screen, and we encourage you to send your questions to all participants, not just the organizers, so everyone can see the questions. After we do our presentation and questions, and we'll close with some announcements with upcoming events and due dates. And now we'll turn it over to Jeff Usher, a Program Officer. Hi, Jeff.
Hello. Hello, everyone. Thanks for joining us on this July webinar. Natasha Frost from the Public Health Law Center, who I know you all know, so I will I won't give a whole lot of introductions. We've probably heard enough. She'll be presenting today, and with that, I'm just going to turn it on over to Natasha. Natasha, it's yours.
Great. Thank you so much. All right, everyone. So today we're going to be talking about drafting effective policies in Kansas. You may notice that Mary is not presenting with me today. Unfortunately, Mary's sister is very ill, and so Mary is spending the week supporting her family in the hospital with her sister. So I would appreciate any kind and healing thoughts that people could send to Mary at this point with her and her family. So I will be the poor substitute for the active transportation portion of this presentation, so I'm going to apologize in advance. But Mary, thankfully, has prepared a great presentation for me to pass along to you on that side of things. So, all right, so you know who we are. This is our beautiful campus that is wonderfully not covered by snow. And as you know, this is what we do. We've been helping you out for the last year and a half, and so I'm not going to belabor this point. But one of the things I just want to remind you is that as I talk to you today about drafting effective public policies, I'm telling you this information as more of a primer and as more to get your brains working as you work with your communities through the Community Change Framework. This is not to say that we are trying to pass off our support of your efforts by saying that you need to be able to draft an effective public policy. That is a role that the Public Health Law Center plays in supporting your efforts at the local level. So just be aware that although I am telling you these things today, and we're going to talk through how to do some of these things, this is what we can do to help support you, is helping you fashion a policy that actually fits your community's needs. So today we're going to talk about how to critically analyze public health policies for their effectiveness and recognize and respond to challenges in policy drafting. And we're also going to kind of learn best practices for policy drafting, and we're going to focus on food policy councils, nutrition standards in the governmental setting, as well as complete streets policies. This is, of course, the standard disclaimer that this is not legal advice, and we are not becoming your attorneys. In addition, I just want to, again, highlight that there are limitations on lobbying and what you can do. And so the fact that we're talking about drafting policies doesn't mean that you should be lobbying your governmental, the governmental folks to change policy or to take a particular policy under advisement. There's a specific webinar that talks about those limits on the lobbying efforts based on what you can do with Kansas Health Foundation funding. So we've talked a lot over the last year and a half or so about how you can create your vision, and most of you are doing, all of you are actually well on your way of creating the vision for what your community should be doing to try and implement either healthy eating policies or active transportation and recreation policies. And so just as a reminder of what we're talking about, you've seen this slide I don't know how many times, but when I say policy, I am talking about any written plan or course of action that's designed to influence and determine decisions. So we're talking about things like ordinances and resolutions, but we're also talking about other documents like comprehensive plans or internal worksite wellness policies. Those are all forms of policies because they're written down and they're designed to influence action. And I want to talk again, and I know we've talked about why it's important to write it down, but I want to give you and highlight an example of why that's very specific to Kansas. So Kansas has a lot of efforts underway. You are leading many of those efforts. One of the efforts that we were very proud to highlight in one of our own webinars through the Public Health Law Center was this great work that was done through a CDC sodium grant, a sodium reduction grant. And it was to actually reframe or repackage how the food was served at the Topeka Zoo. And it was known as the Eat as the Animals Eat campaign, and this is a flyer that highlighted the success of this effort. And they worked to change the menu items and to really promote healthier items in the Topeka Zoo. Now that grant ended, and what has happened is that the offerings at the Topeka Zoo have gone back to the way that they had done them before. And so the unhealthy items have reemerged and the healthy items are gone in much of the food areas. And one of the problems, or one of the reasons that that happened is because there was no policy, either through a contract or through an internal organizational policy that really memorialized this effort. And through the grapevine, when asked about the changes or why they went backwards to the unhealthy food, the Topeka Zoo officials have mentioned that, it was part of a grant and the grant ended. And so just keep this in mind as you're getting a lot of momentum on the ground. That's fantastic. And that means that your community change framework is, that you're using those levers, you're using that effort in a very wise way. But unless you write it down, the momentum can stall or even go back to the beginning if it's not written down and memorialized in writing. So we're going to talk today about what an effective policy is. There is no magic answer to this question of what an effective policy can be, but there are 4 guiding principles. First of all, it's easy to understand and follow. Certainly lawyers try, usually make things a lot more complicated than it needs to be. And, as I can say from my perspective as a lawyer, making things really easy to understand and follow is my goal. Because if you don't understand how the policy applies or how it applies to you, your behavior is not going to be impacted. It also has to be easy to enforce. So having people understand what they have to do, but also understanding who is going to enforce that policy is really critical. It has to be tied to goals, and it has to actually accomplish the goals that it sets out to tackle. And then finally, a very effective policy actually includes a periodic evaluation of how the policy is working and any changes that need to occur, because as we all know, times change, standards change, and so you want to make sure that the policy has enough memorialization to actually, keep it going and be sustainable, but at the same time, change with the times and really be updated to meet the needs of the community. So we're going to go through some pretty basic do's and don'ts of drafting policies. I will say you can take notes, but at the same time, we actually are creating a resource for you that is in the kind of editing phases right now that lays this all out. So it'll be a checklist that you can follow with your community efforts. So first of all, one of the things that you want to do when you're looking at a policy or drafting a policy or working on policy drafting is be clear and concise. So each policy, if it's complicated, you want to make sure that you have definitions of things. If you have a policy that talks about tobacco, for example, you want to make sure that the word tobacco is defined. And, as many of you in that tobacco control world know, the definition of tobacco has really evolved over time. And so definitions can be really critical in making sure that the policy is clear and concise and understandable. Many of you are using definitions in a really important way when you're setting out what healthy means, what nutrition standards are. That's using definitions in an appropriate way. The other thing that you want to keep in mind is, being clear and concise means don't use unnecessary words. Don't use overly legal words just to make it sound fancy. You want to state what you mean and leave it at that. So you always want to keep that language simple and then also being precise. So if you don't want to make the policy longer than it needs to be. You also want to be consistent. So this can be done very clearly by laying out what the policy objectives are out front, and then looking what words are being used throughout the policy. One of the ways we actually find this in school board policies, where they will define things in different ways depending on which policy you're looking at. For example, school property should mean the same thing in your community use policy, as well as in your transportation policy and in your tobacco-free policy. School property should mean the same thing, and quite honestly, you should use the word school property. Sometimes, policy drafting can be kind of counterintuitive, because if you're writing prose, for example, or a literature review, you don't want to use the same word over and over again. Policy is a little different. You want to make sure that you're using the same exact words so that people don't get confused. If you're using the word nutrition standards, you use that word the same. If you say the word healthy, make sure that's the word that you use throughout. Local, don't try and get fancy and try and change up that word local. Just use the word local throughout. And then you also want to make sure that things are consistent both internally and externally. And what that means is that, as we have told you throughout our our work with you, policies are actually not just the standalone. There are other laws, either at the local level or at the state level, that actually impact your policy. Again, going back to that kind of the definition of school property, oftentimes that's actually defined in state statutes, and so you want to make sure that the language that you're using is consistent with both state and local laws, and federal laws if that is depending on the policy. The other thing that you want to do is be specific. So I have a picture here of New York City, and then another picture of, I think it was Wichita. We've driven throughout Kansas, and so I've been taking pictures from the car along the way, and so this was one of those pictures. But you want to really make sure that your policy drafting is specific to your individual community context. What's going to work in Iola is going to be different than what works in Wichita or Kansas City. And so you're going to, and you know that more than anything because you're embedded within your communities. But when you're drafting your policies, you want to make sure that you're specific to your own community context and what works for you and the language that's going to work for your community. The other thing that you want to keep in mind is that we may want to accomplish, the golden egg and and find that golden ticket, but you also have to have a dose of reality. And we've actually shown you that feasibility slide throughout our presentations with you all. And it's just, when you're drafting your policy, you have to be practical and reasonable. You have to think about things like cost. You have to think of things like effective dates, and this is especially true as you're phasing in healthy eating standards or active transportation design standards. When are they going to be effective? And it has to be reasonable for the people that it's impacting. You also want to make sure that people have the ability to follow the policy. A great example is in Minneapolis, there's a healthy corner store policy that requires certain retailers to stock fresh fruits and vegetables. The reality is that many of the retailers, they do not have the appropriate refrigeration for a wide variety of fruits and vegetables. And so there is a built-in problem with enforceability and implementation because they cannot follow the policy because they don't have the refrigeration space that's needed. So you have to be thinking about all of these things. So just like there are things that you want to focus on doing, there are also things that you don't want to do. So first of all, and first and foremost, is don't forget to do your homework. And I know that this is just a reminder because the community change framework actually builds this in. It actually creates a structure where it's really hard to forget to do your homework because that builds in the component of involving stakeholders. And then we're here to help you review sample policies. You want to see what other people are doing, and what other people are doing across the state of Kansas and in other communities that are like Kansas, like folks in Iowa and Minnesota and Wisconsin and some other southern states that actually fit within kind of the model and the regionality of Kansas. Now, it's very hard for you to forget to involve legal assistance since we're always knocking on your door to try and help out. But the idea is that many policy efforts, people run into challenges because the policies that they're creating run afoul of either state or local laws or go beyond what that entity is able to do. And then the other things that you got to keep in mind when you're doing that homework is figuring out what your deal breakers are. And this is we see this a lot with kind of defining healthy eating. What are the deal breakers? Is it that you have to have a sodium requirement, or how we define healthy? Is it 50% of the items versus 100%? You need to sit down with your stakeholders and figure out kind of where those lines are, and then where that line is, where if somebody goes and says, what, I'm not going to do that, then that's something that you're going to consider and not going forward with that policy change effort. And then finally, anticipate challenges. And there are lots of ways to do this. And again, this is just involving that community change framework within your process. When I talk about anticipating challenges, I don't just mean legal challenges, because that's where everyone kind of goes to. But you have to think about the political challenges. So what sort of kind of pushback are you going to get from the community, from those voices that might not be as far along in the process or might be impacted, and then thinking about the bureaucratic challenges. And what I mean by that is the implementation phase. So if you have a particular, like here in Minnesota, we have this new disparities report that lays out very clear directives that the Department of Health has to follow. And there are some kind of bureaucratic challenges that they're finding in implementing those recommendations because of the way that the Department of Health is structured. And so you just have to figure that out when you're drafting the policy to try and overcome those challenges, because again, each challenge is an opportunity. And as you're drafting the policy, that's the time to anticipate those things so that you can actually draft the policy in a way that addresses those issues. And then finally, the legal issues that come up, either because it's not just because it conflicts with state law or federal law or other legal issues. That's what you have us for, to help you identify those challenges. The other thing that I think is really important is don't just take what has been done before and then just write that up and then stick that in, draft the policy that way. And there are a great example is Douglas County has this fantastic resolution for a food policy council. It's wonderful, it's comprehensive, but it doesn't work for every community because that resolution was created for Douglas County, and each community is very different. So you don't want to just take for example, the Douglas County Food Policy Council resolution and just cut and paste it and put it into your policy. You want to tailor it for your community needs. You also don't want to draft in isolation. We see this a lot with folks that are not lucky enough to have the Kansas Health Foundation supporting their efforts, where they just feel like they're doing it alone, and they sit at their table and they write up a policy that is not consistent with what the stakeholders need, or it doesn't consider some of the challenges that other communities have faced. You are really lucky in the sense that you have this community of HCI groups that are working on these efforts, as well as the larger Kansas community. So I really encourage you, as you're doing policy drafting, to invite them into that process. So things like stakeholders, involving legal assistance, and the other grantees, because quite honestly, your policy is actually not just going to be impactful in your community. Other communities are going to be looking at the policies that you're drafting to use them as guides, to use them as examples of what to do or not to do in their own community. And so just think about it from that larger Kansas perspective. And then finally, a lot of times there is, when you involve stakeholders and a variety of voices at the table, you get exemptions. And the reason that happens is you want to opt things out to actually protect the interests of the people at the table so that you get their buy-in. A couple examples are, do you exempt sugar or flavored milk? And do you call that a healthy beverage because you want to make sure that the dairy industry is at the table and is supportive of your policy? There are just things that you have to think about as you're drafting policies. And just the takeaway from this is just be very careful that the exemptions, so the things that you kind of opt out of being covered by your policy, doesn't overwhelm and actually make enforceability impossible. This has happened a lot in the tobacco control world. And so for those of you who are aware of those challenges and struggles, just use that as an opportunity to apply it to your active living and healthy eating work. So, and again, just weakening objectives, making interpretation harder, as well as inspiring challenges, actually legal challenges with a lot of exemptions. Those are some of the problems that come up. So here's a review of kind of what to do when drafting policies. And we just wanted to give you this as the primer, thinking about as you're sitting down with your stakeholders and thinking about what a policy might look like. Those are the things to keep in mind. And again, we're going to give you a fact sheet to kind of a checklist to go over those with your larger groups. So now we're going to get into the meat of policy drafting. And so these are kind of the general elements that we in the public health community really look to help guide our efforts in policy drafting. So findings are those science-based efforts that, or evidence-based support for moving forward with a particular policy effort. The purpose, you guys have been doing a lot of great work with the purpose portion of policies, and that's just really the goal of the policy, what drives the policy, why do you need it. Definitions are just the key concepts in a policy that need to be defined. Don't go overboard on the definitions. Not every word needs to be defined, but it's the ones that people might not all agree, what is a complete street, or what is the appropriate design standard, or what is healthy. Those are the sorts of things for definitions. And then the kind of the guts of the policy is under that main policy provisions. Then there's exemptions, enforcement, implementation, and evaluation. So these are all the things that guide how you draft it and what you need in each of the policies, but they're not exclusive. There's not always a need for a findings section, or there's not always a need for an evaluation component. And we're going to go over kind of how these impact the different key areas, and we're going to start with our active transportation and recreation side of things. So you've seen this, tomato, potato, potato slide. It's like, what's in a name? There is a continuum of what we are talking about under active transportation and recreation policies. And, some folks call it a complete streets policy, and other communities will call it a active transportation plan. It's really conceptually, it can mean a lot of things. And so we're going to use the term complete streets policy, but that doesn't mean that these concepts can't be applied in other areas. So on the left, you'll see kind of the general policy drafting elements. And on the right, you'll see these kind of 10 key elements of complete streets policies. And so we're going to walk through and provide examples under each of these 10 key elements. So first, for the findings on purpose, is really what the complete streets world calls this vision and intent. So that is, if we're just looking at kind of that vision and intent, what that is the findings section. And so it's providing, as in Pipestone, the reason for the policy. So in Pipestone, Minnesota, there's a complete streets policy. The language is here. I'm not going to read the language, but you can refer back to it when we post the presentation. And it's like why we care. Streets are a critical component of public space and play a major role in establishing the image and identity of a city. So, establishing why we care about these complete streets concepts is that initial portion, that findings. And then from the purpose and vision, you have some other examples here where you have, the guiding principles. In Portsmouth, New Hampshire, it's for a convenient, safe, and accessible place for all users. And so that's the heart of the mission of that policy. So it lays it out very succinctly in the very beginning under the vision. But again, it doesn't have to be called vision. It can be called the purpose, like they did in Peru. So it's about improving the sidewalks, the streets and sidewalks, to make walking and bicycling more convenient. So it's how you want to vision these. And we have a lot of examples of strong language. But again, going back to those kind of drafting components, you'll see that these are very strong, succinct statements that talk about what is going to guide the rest of the policy. So then some of the things that we found under the definitions can be, defining who the users are, what the projects and phases are, and who has jurisdiction. So if you're looking at that, just defining the term complete streets can be critical. So in Portsmouth, again, they actually define the concept of complete streets. And this is a fairly common definition of complete streets. But if that is a word that is is confusing for your stakeholders and for your community, using that as a definition is going to be really important. In Lawrence, they actually define the word streets. And this is consistent with other state laws that define that word. And so you want to figure out what are the concepts in your policy that need those definitions. And then again, don't draft those in isolation. You want to make sure you step back and make sure if there's a state definition or there's other local laws that define what streets or complete streets are, you're going to want to make sure you use the same definition. And that's where you can use the Public Health Law Center. We can help you find that out. All right, so the main provisions of complete streets really focus on those four concepts of the network, the jurisdiction, the design, and the context sensitivity. So when you're talking about the main provisions of complete streets, Waterloo really sets a guideline for who are the users and the modes of transportation and how is a policy impacting those folks. So this is an example of how the main provision on the users and the modes. For jurisdiction, often, again, complete streets, for many of you working in this field, you're not just talking about local level policy. You have to actually have your policy figure out how to link into the other the other policies that impact the streets in your town or your city or your county, which is often linking to the federal and state transportation improvement projects. So including that as a main provision and how that's done is going to be really critical. Thinking about it from this applies to every single project and phases is really important. You don't just want new construction of streets and sidewalks and thoroughfares. You want it to apply to things along the way. So repaving and rehabilitation projects needs to be a component in complete streets policies, and that's the way that they did it in Pipestone, Minnesota. And then a really critical piece of this, one of the most critical complete streets components is the design criteria. And so Auburn, Maine actually laid out a very specific guiding principle to what the design criteria would be for the planning department. Because that is where they're going to that's where they're going to go to determine how they are using or what they're using to design their structures. And so this is one of the most critical pieces of a complete streets policy, is actually having the design criteria laid out specifically with, as you can see, there are specific additions and standards that it cites to. Not just general complete streets concepts. It's very specific ones, and there are a list. This is one list you can use, but there are other lists that we can identify for you that actually help really implement this design criteria in a meaningful way that really truly promotes biking and walking. And I wanted to throw in the Hayes master plan because, again, we've been talking about this complete streets policy with it in mind of a resolution. I've been giving examples of resolutions, And so this actually thinks about it from a kind of a different lens, and this is from the lens of a master plan. And so it's not as clear, clean and clear-cut as some of the other complete streets resolutions that we've seen in previous slides. This one has a more kind of fluid, kind of a iterative process in the way they lay out the information. But it's still, again, because design standards is so important, we wanted to have 2 slides that focus on how you can actually lay out the design standards. In Hayes, they actually laid out the specific design standard that they wanted to use for a bike lane. So that actually is another way to go. Instead of linking it to kind of a national model or other kind of national organizational design standard, you can actually put in your policy the specifics that you want to follow for your local planning department. So it's another way to actually lay out the specific design standards in policy. And then finally, kind of the understanding the kind of context sensitivity is really important. This is actually important for several stakeholders who, in the beginning, and some of the national effort or in other cities and counties, this is language that's really, really important for a specific subset of a community, often businesses. It's really important for the economic development side of things to have this language in, and it is an important concept as well. And so this is how Auburn laid out that kind of context sensitivity issue. All right, so for exemptions, so it's the same for both kind of how we lay out our general drafting elements as well as complete streets. And this is, again, where you want to be really careful that the exemptions don't swallow the policy when you're doing complete streets policy work. So there, you can have it a variety of ways. So in Pipestone, they actually lay out kind of the specific exemptions that are available to be exempted out of the complete streets policy. But I think, it depends on your situation. These are very locally specific, and there are examples of a very general statement of exemption. So we have several. We didn't use this as examples, but there are several complete streets policies that just say, the projects that are actually cost too much, are exempted, or their exemptions can be provided on a case-by-case basis. I mean, there's a lot of ways to talk about exemptions in this kind of complete streets context. So but I think what we want to get at is this is a very specific list of exemptions, and so it doesn't have a catch-all, which is very important when you're talking about limiting exemptions to complete streets policies. All right, so moving along, and the enforcement and implementation. We have several complete streets policies around the country that are not being implemented. And it's happening. And so how to do that is through the drafting of the policy, making sure that there are strong implementation pieces. How is this going to get done? And so in Auburn, that you can see, they actually say this policy will be implemented through, and then it lists out how. And this is really critical because it provides a guide for those that are going to be implementing it, and it actually talks about people who will be doing the implementation. For here, it's the Joint Bicycle Pedestrian Committee. And so it's really critical that you have this implementation language within the policy, and don't just assume that because you write it down, it's going to happen. Make sure that you actually have the vision and that that vision is written down for how it's going to be implemented. And then finally, evaluation is just really important because it actually talks about how you're going to look at the success of the policy and what's working and what's not. And Lawrence has some great language on how they're going to review and have an evaluation component. And so this is a great guide to getting the information, what information is going to be collected and why. So really succinct language there on the evaluation side of things. All right, so we are going to move on to the food side of things, the healthy eating side of things. And so let's start with our Food Policy Council work. And again, thinking about what's in a name, I've talked with several of you, but throughout the last few months or last month, especially at the World Grocery Summit. But there are a lot of terms that we could use for our Food Policy Council. One of the things that we're kind of putting around in our heads right now is this Food and Farm Local Task Force. Given the new law that just got passed at the state level, it follows that language, feels a little less scary potentially. So we're going to be kind of kicking that around, and as I'll mention later on in the webinar, there's a pre-session to the Built Environment Conference that is going to focus on food policy councils. And so more to come on that, but just wanted to throw that new name out there for you guys to percolate on. And I think when you're talking about the Food Policy Council, remember, there are different ways to look at it. There's two buckets. There's the publicly appointed, and then there's the nonprofit model. For the publicly appointed, you have a resolution that actually creates the structure. And then you have operating procedures that help kind of run the day-to-day operations, the meetings, and that sort of thing. Sometimes they call them bylaws, but they're really operating procedures. And then you have the nonprofit model that actually, to create the nonprofit, you have articles of incorporation, and then you have bylaws that actually run the day-to-day operations. So what I'm really going to focus on today is that publicly appointed resolution. So we're just talking about the policy that creates the Food Policy Council, the entity. And so quite honestly, it's limited. So there are, when you're talking about just that resolution, there are 7 key concepts that are listed here. So findings, vision and goals, responsibilities, membership structure, funding, and restrictions are the kind of ones that I came up with that are cropping up in these resolutions. So let's just talk first about those first 3, the finding, vision, and goals, and the responsibilities, because those overlap, and folks are doing them a little different. So let's look at Crawford. So you see the whereas, and often the whereas in a resolution flags a finding for you. So Crawford County has a finding that they lay out why they need a Food Policy Council. It's because, there are a lot of food policy councils that have existed, and they actually are really important ways to examine how food systems work. And so it lays it right out there in the beginning through a finding of, why are we even talking about this? Why are we having this resolution? The other thing that is there is the vision and goals. So this is a really critical part. So South Hutch actually created a Food Policy Council recently, and they laid out a list of the vision and the goals of what the Food Policy Council is going to do and why it's being created. There's the food desert, there's the need for a grocery store or local food provider. These are ways of framing the goals and the vision of the actual entity that it's about to create. And then finally, another way of looking at this is like creating responsibilities for the group. So in Champaign County in Illinois, they actually laid out through their purposes section how the what the Food Policy Council will focus on and what they will be doing, the responsibilities from the very, very kind of esoteric, which is like bringing together stakeholders, to kind of more concrete things like establishing a website. So it kind of runs that spectrum of responsibilities. And again, this provides that kind of vision and overall structure for the Food Policy Council. And what I'll say is that, generally these sort of this is the responsibilities section is important to lay out the themes, but you don't want to get too specific because you don't want to tie the Food Policy Council down too specifically to a particular goal or purpose, so that they don't have the ability to really respond to what they're seeing in the community of the needs of that kind of food systems. So then when you talk about kind of that main provisions, like what is the gut of the Food Policy Council? And it's these 4 concepts. It's membership, structure, funding, and restrictions. And honestly, the biggest thing that I'm seeing, the most important piece, is membership. And I think you could put membership in the kind of the bucket of definition, but because it's such a critical part of the Food Policy Council, I actually would say it is the most critical part of a resolution, is naming who's going to be on the council. That's why I put it in the main provisions section. And you have them doing it a lot of different ways. So for Crawford actually laid out the membership very generally. It actually designated that another nonprofit was actually going to be running the Food Policy Council, but that each of the commissioners was going to appoint a member to the council. And so the membership is really going to be determined by this other entity, by Crawford County Eat Well, but the commissioners would each have kind of one of the members appointed, but the other members would be designated by that advisory council. Now compare that with South Hutchinson, that actually it specifically lays out two of the members. So it's the city administrator, and then Reno County Department of Health, and then the city council appoints the rest as necessary. So it's much more. It appoints two people, and it specifically says who they are. And then it kind of leaves the other members open to the city council and what they want to do. Now, there's this, and this is, again, that spectrum. And then there's Douglas County that really lays out the specifics of the people on the council. And the way Douglas County did this, from my understanding, is that they went through and they decided who do we want around the table, who are the most important players in the food systems in Douglas County, and then they listed them. And I think that if there is an opportunity to be very specific in the membership that you want on your councils, this is the place to do it, so that you don't leave it to chance. Having the resolution have specific membership listed out is really important if it's possible. So another important piece is figuring out the funding, or at the very least allowing the flexibility of applying for grants, as in South Hutchinson. So there is an expenditure that the city has agreed to take on the annual budget, but at the same time, the resolution specifically says that the Food Policy Council can actually seek grant funding with its activities, which is an important mechanism to be able to support the Food Policy Council going forward. And then finally, from like the restrictions phase, this is really useful language for folks that get really kind of squirrely about, well, the Food Policy Council can't make policy. No, I mean, as many of you have heard me say, you know, your Food Policy Council creates a structure to have a conversation about what is needed to try and enhance food access and identify challenges and then identify solutions. It's not that they pass policy, because they're not a governmental entity in that way. They're not a city council necessarily, but they can advise the governmental entities on what's needed to improve the food environment. That's the goal of a Food Policy Council. But so one of the ways, and South Hutch actually had a great way of doing this, is they actually identified in the policy itself that the Food Policy Council is an advisory board and has no authority to take official action on behalf of the city council. And so you can see that this is a great way to use the policy language to try and to anticipate challenges, right? Because this is actually a way to actually counteract somebody saying, oh my gosh, they're trying to tell me what to do. Well, no, they're an advisory board. That's what they do. They do not change policy. So this is a way to use that policy language to actually accomplish that kind of anticipating challenges. All right, so then let's talk about healthy food and beverage policies, or bids and RFPs. And quite honestly, this one is hard to kind of put into the framework that we've been talking about so far, which is why I left it for the last one. Because look at this. I mean, you can see, if you're talking about a contract or a bid, it's not just about the food, and it's not just about nutrition standards or how you get the food or the cost of the food. It's so much other stuff. So I listed here all the different provisions in the city of Lawrence, their RFP. This is all the list. And you can see the bottom ones there in maroon, those are the ones that we're wanting to impact for our healthy food work, not that other stuff. So you have to think about it from like a larger perspective that, you know, the framework that I just set out for this nutrition, the healthy procurement work, doesn't really fit as neatly. Again, the Riley County Fair example that I'm going to use today, like there's a lot of different stuff in there that has nothing to do with the type of food served or the cost of the food. It has all this other stuff in its RFP. So I just wanted to throw it out there that it's not as neatly fit as some of the other work that we've just laid out. But I'm still going to try. I'm still going to try and put it within the framework because there are also policies, healthy food and beverage policies, which is kind of that governmental, either internal or a resolution or an ordinance that can be created. So let's just talk through some of the ways that that's being done. So the intro to healthy food can be really important in policies, and the city of Lexington in Lexington, Kentucky actually did this in there. They actually have a city policy that actually lays this out, and so they have the intro that really talks about why are we even talking about healthy food. It lays out that kind of reason and the purpose for moving forward with healthy food in their park and rec department. You know, the statement of goals and purpose, it can actually be in a contract as it, or an RFP, as it was done in Lawrence here. It could be in a policy, as it was done in Lexington. You just have to lay out why you care, why are you even talking about nutrition standards or pricing components or local sourcing. That is a way, and we have lots of examples of how to do that in ways that will fit your individual community need. Definitions. This is the most critical part of this type of policy, in my opinion, the definitions, because quite honestly, the definition is where you get your nutrition standard or your example or your definition of local sourcing. So this is kind of the meat of these policies. The nice thing is that you don't even have to like come up with your own definition. Healthy Kids Challenge already has created the definition of healthy, and it's actually Riley County Fair had their RFP, and it actually used the exact language that was laid out in this fact sheet that you have available to you. And so I think that there's a really, I mean, and they cut and pasted the language from this document into their RFP for their nutrition standards. So an example of local sourcing, which I know that a few of you are working on. Here's an example from Cleveland where it talks about the definition of what local means. And so in Cleveland, they actually have a policy or an RFP out for the for mobile vending, and they actually focus on local food sourcing. So this is how they define local as it relates to their park and rec department. And so again, two critical definitions that if you are talking about nutrition standards or if you're talking about local sourcing, you've got to have that in your definitions, and it has to be really clear. All right, so the other things that are available in the healthy food and beverage policies and RFPs and bids are percentage requirements, pricing requirements, product placement, the use of promotional space, and then labeling. And I'm going to not go over all examples, but there's percentage requirements. 50% seems to be kind of the one that we're landing on right now with nutrition standards. We are going to be looking at creating some resources about, you know, going either 50% or 100%, because there are reasons to do 100%. And I know that the Healthy Kids Challenge has been talking with you about those sorts of things. But whatever you decide when you're going through that kind of process of involving your stakeholders, making sure that that's very clear in your policy is really critical. And so Riley County, a minimum of 50%. And it's also really important that you say a minimum of, and instead of just saying 50% of all food and beverage items, because if you can imagine trying to get exactly 50% of the items can be kind of hard. So you want to have a minimum set for folks. So pricing requirements is really critical. We know with healthy food, often the healthy foods are priced higher than the unhealthy options, and that can really impact the success of the sale of those healthy items. And so there's really simple language, and this is actually was used in both Riley County and in Lawrence, where it's just saying very simply that the products that meet the nutritional standards are equal to or less than the comparable products. And I think that that is just a very succinct way of saying that. And, you know, there's going to be technical assistance needed to implement that, but I think this is the easiest way we found in our research to actually kind of state that pricing requirement. There have been policies that we found that actually lay out the pricing or that require approval of the pricing prior to it being posted. So that's another option for you in your work in your communities. Product placement is also, and it's important that you have easy access to the nutritious items. And so Lawrence actually used this language. This is specific to vending machines, which is probably the most important. But we have a lot of examples on how to how do you put the nutrition or the nutritious items in a way that's actually going to make the healthy choice the easy choice. And there's a lot of research being done, and there's no kind of, again, magic way of doing that, but there are mechanisms that you can put into place in the contract or in the RFP that really are specific to help guide the vendor to making that kind of, again, that healthy choice the easy choice, which is our role. The promotional space, there hasn't been a lot of work done on this. It's starting to take hold where there's requirements that you can't advertise anything except for those that are meeting the nutrition standards. I will say you have to be kind of careful about this. This is something that if you're exploring limitations on advertising or promotional space, you need to talk to us first, because there are ways that you can do it that avoid legal challenges based on the First Amendment. But we have a lot of expertise. We have an in-house expert on that, Julie, who is able to help walk through both the promotional space issue as well as the labeling issue. All right, so that covers a lot of information. I just wanted to share, we had this policy drafting checklist that we created 4 years ago. Wow, 4 years ago. We're revamping it. We're figuring out how to make it Kansas specific, and it is in the pipeline and should be on our website in the next 3 to 4 weeks. In the meantime, if you need information about what has been talked about today, just send me a quick email. Again, Mary's out of the office indefinitely due to the illness in her family, but I'm taking point on all of the work with HCI, and we're in constant communication. But if you have questions in the meantime before we get this checklist out, let me know. That being said, we are really excited. We actually relaunched our Kansas webpage, and so here's the website. It's up there in your upper left-hand corner under Kansas Resources. And we're excited to say that we have 2 new specific pages that are highlighted on that page. One is a list of resources that I'm sure you've gotten through the emails on farmers markets. And so it's a comprehensive set of resources to help you understand how to operate farmers markets. It looks at state laws and local laws that impact farmers markets, and is really meant to be a hands-on resource that your community stakeholders can use to help identify how to ensure that farmers markets are thriving in your community. We also have the first of our series of biking and walking resources, sorry, Mary, very clear, bicycling and walking resources. And so we're going to have another set that is going to be, that's in the pipeline, and will be released just prior, hopefully. It's kind of put into flux a little bit with Mary, but hopefully before the Built Environment Conference. But I really encourage you to check out these first 3. They're really fantastic and provide a lot of information on the work that you're doing in your communities. And then just wanted, even though this is not work that you're doing directly, we are also working on a series of resources related to child care work, and we've created this map that talks about child care centers and family child care homes in Kansas. And in partnership with the Kansas Action for Children and Child Care Aware of Kansas, we're actually working on these series of resources related to the child care setting. And so I just wanted to highlight those for you as well. These are all on our website, so take a look on our Kansas Resources page. So just a couple of announcements. And I'm going to turn it over to Vicki shortly. But the Built Environment Conference is September 16th through 18th. And so there is a pre-session, as I mentioned, and it's going to focus on food policy councils. Both Mary and I are going to be there. We're really excited. We're really gearing up and working with the folks in Kansas who are organizing this to really help move the needle forward on making Kansas the most prolific place for food policy councils in the country. That's a goal, and I think that that's a really accomplishable goal because there's so much excitement about the idea of creating food policy councils that will now be known as Food and Farm Local Task Forces. And so please join us for that if you're able. And I know Vicki's going to mention this, but I just wanted to say, you know, HCI, there's an HCI dinner on that night as well that is going to be sponsored by the Kansas Health Foundation. And then the conference runs on the 17th and 18th. The Public Health Law Center, because we are going to be there. If you are interested in reserving some time to meet with Mary and I, or both of us, please let us know, because we'll work around your schedule to try and figure out a time to meet with you and your communities to try and really either hammer out some ideas for policy drafting or go over some legal issues. So we want to set up some time to meet with each of you as you deem appropriate. So with that, I will kick it back to Vicki to go over some of the other announcements.
And before we do that, do we have any questions? Jeff, has anyone typed any questions in the chat box? Or if you have any questions, now would be the time to put them in the chat box for Natasha.
Yeah, we don't have any questions at this point. It looks like Audrey did raise her hand, and I can't unmute her because she has not entered a PIN for some reason. So Audrey, if you do have a question, you can please, if you want to chat, put it in the chat box. We can try to answer that.
So I'll run through announcements then while we give people a couple of minutes, but if you have questions, please type them in the chat box. Jeff will see that and can read them to Natasha. Natasha, that was just excellent. Thank you so much. I encourage everyone on the webinar today to share this presentation today. It will be posted on SharePoint within the next few days for team members that didn't participate today, other key stakeholders. This is just excellent information, so please share this webinar. There will be an email link that will come to you. It's a short survey to get your feedback about the webinar, and Adrian really does review those with the TA team and use that information in developing future webinars. So please reply back if you see that survey link if you have the time. The information will be used to plan future webinars, as I said, and the next webinar will be September the 10th at this noon time. We will not have one in August as we are moving to offering webinars 3 to 4 times per year rather than monthly. So mark your calendar for September 10. Another reminder, the semi-monthly tracking forms are due July 15th. If you have questions about that and filling those out with what your actions are within the Community Change Framework components, please call or send an email to some of your technical assistance folks, and we'll be glad to help you. If you're one of the original HCI 1 teams and you know who you are, don't forget the grant status report and the annual plan, which includes SMART objectives, are due August 1st. I know some of you are currently working on those and having your TA providers review those. So if you need some help with that, please contact your technical assistance team. And as has just been pointed out to you by Natasha, September 16th through 18th with that Built Environment and Outdoor Summit is a great opportunity to attend if you are looking for further networking and education, if you want to attend a pre-session about Food Policy Council, and as she mentioned, Kansas Health Foundation will have a dinner provided for you that Tuesday evening if you do plan to attend. This is an example of, you received information recently about some additional technical assistance dollars, and that you can use those for education, convening, technical assistance, travel related to that. This is an example of something, if you choose to attend the Built Environment Conference, you would be able to use some of those dollars for your travel expenses associated with that attendance. Something else that we don't have on a slide that Adrian reminded me is KPHA, the Kansas Public Health Association, meeting is September 29th through October 1st, and it's going to be in Topeka. And the Kansas Health Foundation did submit a proposal and will be presenting, and I believe Scott and Jeff are in charge of that. We'll be doing an HCI session on Tuesday, September 30th. And if any of you are planning to attend KPHA and you would like to be involved in participating in that session, you can let Jeff Usher know, or Adrian, or Scott. And then the final announcement that I have to share is a reminder of the convening of all 20 teams will continue to be held in October. And this October, it will be October 2nd and 3rd. And the change is that it has been reduced from 2.5 days to 1.5 days, which is in response to teams sharing that it is sometimes difficult to take that much time away plus the travel. So the plan to attend that, it will be in Wichita, and save the date. More information coming with that soon. That's all the announcements I have. Do we have any questions yet, Jeff?
Well, actually, I'm technologically challenged here. It looks like Elizabeth Adlaw has a question, but I can't find it. It says a question. So I'm going to take, Liz, I'm going to take you off mute. So are you there? And do you have a question? Elizabeth? Maybe she doesn't. My chat thing just disappeared, so I can't find if anybody is, but usually there's a question up there and I can open it with a question when I hit the question mark. So that is the only question I see on the screen. Well, it looks like, for some reason, it looks like Audrey has one as well.
You know, the other way to do this, I have my email up, so if somebody has a question, they can just email it to my email, which is right there. And let me just, while we're waiting to see if anyone emails me a question, I just, again, want to say what the Public Health Law Center's role is to help do a lot of what I just went over. We can help identify good samples. We can help identify your existing state and local context, so making sure that those terms are consistent. We can actually help, you know, if we give you some language that you might want to use with your stakeholders, and then you get, you know, kind of the red line, right? The stakeholders like, no, 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 that doesn't work. We can help problem solve based on our experience with other communities with similar issues. You know, like if you take your Food Policy Council language and, you know, they, for example, pull out all the references to the word healthy. We can help problem solve and identify ways where that other communities have actually encapsulated the word healthy in different, but using a different term that's less politically hostile. So I think, you know, you can utilize us in that way when you are ready. Another way that we've really, you know, again with the contracts are really complicated. So many of you, you know, have asked, if you give me a draft of your existing contract, I will look at it and determine whether or not, you know, is there ways to insert nutrition or, you know, these other concepts into the existing contract, or at the very least prepare for that kind of the renegotiation of a contract down the road. Okay, I got a question. Okay. Elizabeth asked, can you briefly talk about the structure of a food policy council? Yes. So a food policy council, well, there are lots of different structures, but the Food Policy Council can be structured in a way where it's an entity. So the publicly appointed Food Policy Councils, they set up who's the membership, and so often it's a kind of a city or county employee who is the coordinator or facilitator of the meetings, but then the membership is actually other people, either appointed by that governmental entity or actually listed out, like Douglas County, listed out in the Food Policy Council resolution. And then that entity helps design the next step, which is usually a food policy assessment. And then that food policy assessment actually looks at the food system, where it's failing, where there are opportunities, how to overcome some of the challenges. And I'll say that's a very broad overview. There is this great webinar on SharePoint where I think, is it both Mark, Winnie, and Eileen Horn are actually, they talk about the structure of food policy councils. Is that right, Jeff?
Yes, it is.
Yeah, and so I learned so much from that webinar, and so I would really encourage you, if you're interested, I know, interested in the structure, it's going to be really important to look at that webinar. The other thing that I'll say is, we've we're looking at it from 2 points, right? I've been talking about from a publicly appointed food policy council and a nonprofit. And I just want to remind everybody that Crawford County took a path that is somewhat of both. So there is a component of a publicly appointed membership, but it's being facilitated and organized by a nonprofit. And so I think that there is a way to look at it not necessarily through the lens of just those 2 buckets, but there's this kind of third gray area that is an opportunity to explore within your community because if you don't have a governmental entity that's interested in actually running or supporting the Food Policy Council itself.
I actually found all the questions now.
Okay, I have.
And that was one of the questions. Thanks, Elizabeth. We have another question from Susan. Susan, she's asking how many HCI communities are working on the Food Policy Council. There are 2 that are officially working on a Food Policy Council at this point. But there are a number of the HCI communities, that's their policy priority. That's Wichita and Allen County. But there are others that are interested in pursuing food policy councils, but not as their policy priority, which is certainly something we would encourage as well. And again, just another plug for the pre-session at the Build Environment Conference on September 16th. I'm sure we can go over more details around the structure of the Food Policy Council at that point. And then Elizabeth had another question, and that was regarding the pricing requirement example of the cost being equal to or less than comparable products. Does this mean the work site would be responsible for covering the additional cost, or this would be something the vendor would need to attend to, only using lower cost healthy food items?
No, the way that it's set out, or the way it's supposed to be implemented, is that the vendor actually creates the pricing structure for the food served. And so the vendor actually determines the cost. And honestly, the way it's working out is they're increasing the price of the unhealthy option to actually, as we are moving through our food system and the healthier options, the prices are coming down on healthy options, and there's much greater variety. And so we're slowly seeing that kind of disparity between healthy food and the unhealthy food kind of equalize a bit, but we're not there yet. And so for a lot of the products, it's just increasing the cost of the, I'm trying to think of an example of the grilled cheese, so that the hummus wrap is the same price.
Okay, we do have another question. I think this is more for me. It's from Audrey, and I believe that's Harvey County. So as a coalition coordinator, this information is intended for us to create the bike master plan in collaboration with the community. Our city is looking at hiring a firm to create a bike master plan themselves. Is our extra technical assistance dollars up for them to use this for this purpose? You'll see when we send out the amendments increasing your grant by $25,000 that it can be used for, I think we very specifically say convening, technical assistance, planning, and education to help advance your policy priority. I will personally need to approve all of those. So that question could come directly to me, and I will say yes on that because it is planning itself. And then let's see if there's any. Oh, I think that's it. I think that's it. Susan did compliment you on your presentation and slides, Natasha.
Thank you.
That's all the questions. I think we're ready to wrap up today. Again, Natasha, just excellent information. We'll get this archived as soon as we can. And all of us, let's keep Mary and her family in our thoughts. And everyone have a great rest of the week. Thank you for attending.
Thanks,
Bye
everyone.
now.
Bye-bye.